Government yesterday dispatched the riot police with dogs at Harare's Parengatua group of hospitals in a futile attempt to stop nurses from protesting against low salaries and poor working conditions. In other parts of the country, nurses stayed away from work as they downed tools to compel government to pay them in United States dollars as the country's currency continues to be rendered worthless by runaway inflation. The protest forced the Health Service Board to call for an emergency bipartite salary negotiating meeting with the Health Apex Council. The meeting, however, yielded nothing after the negotiations failed to come up with an agreement to address the nurses' concerns. HSB Executive Director Engelbert Mbengwa said he was in a meeting when contacted for a comment. Health Ministry spokesperson Donald Mujiri referred questions to the HSB. In a statement, the Health Apex Council said, "The meeting took off at around 1 p.m. Out of all our grievances, the employer did not provide any solutions, save for his usual response that they are seized with the matter of numerous promises said to be on the pipeline. For the finer details, our representatives in various centers will give a full update tomorrow at our usual meeting places. Meetings will start at 8 a.m. tomorrow. Let us come in our numbers, in our uniforms, carrying placards as we continue to demand living wages and safe working conditions." Zimbabwe Nurses Association President Enoch Bongo said there was nothing tangible that came out of the meeting. We met the HSB today for the first time after 14 months, Bongo said. No salary offer was tabled. The employer wanted to get an understanding of our concern, which we tabled, but without any step taken by the employer to address our concerns, the struggle will continue. We will not resume duty until issues we have raised have been addressed. Some nurses who gathered at Parengatua yesterday held placards and chanted slogans in protest over poor working conditions. They denounced the HSB for turning deaf ears to their plea for improved working conditions. Earlier on in the morning, government had ordered medical superintendents to report health workers who failed to report for duty. When Newsday visited some major hospitals in the capital yesterday, patients were queuing at out-of-patients department, waiting for nurses to attend to them.